Hello and welcome to Ask the Doctor. My name is Jerry McGee and I'll be your host for today's show. We're here in Pittsburgh, Pennsylvania at Wellness Associates with Dr. Eugene Goldberg. Dr. Goldberg, thank you very much for your time. On today's episode, we want to talk about this problem of spinal stenosis. One of the viewers wrote in where they were having a back problem. They went to a doctor. They were told they have spinal stenosis. Surgery was recommended. And they would just like to see, are there any other options, or what could chiropractic care do to help them with this diagnosis of spinal stenosis?
Depending on how bad it is and how soon you catch it, basically, in my experience of 30 years, Jerry, is basically what it is. Spinal stenosis is a vertebrae out of position. It's a hard bone pressing on soft nerve. It's causing pain. It's a pinched nerve. In addition to that, a complicating factor is they have bone spurs on the x-ray, which is arthritis. Okay, so what we do is we treat we give the misaligned vertebrae through chiropractic. We take pressure off the spine, and then we treat the arthritis through nutrition. So if you treat the arthritis through nutrition, you get the underlying root cause of why they have the pain, which is a pinched nerve, which is a misaligned vertebrae. You give a chiropractic adjustment. 9 times out of 10, you can tremendously help these people, 80, 90, 100%, whether it's their low back, mid back. Usually it's the low back. There's some cases where you have the spinal stenosis in the neck. Either one, it's the same thing. Chiropractic adjustment, nutrition for the arthritis. 9 times out of 10, if you catch it soon enough, then you don't need surgery.
So from a standpoint, and one of the things that just popped into my head also is we often on our shows talk about preventative medicine, right. Getting periodic evaluations, right. Because if a person was coming in getting periodic checkups, right. Maybe getting some adjustments, one, they might be able to not ever have the problem to start with, right. But if the problem has developed, you have the ability now to nip it early on, which is always a much better approach.
It's similar to dentistry. If you have a cavity, get the cavity fixed, whether the cavity's in your neck, the cavity's in your low back, because if you wait, it's going to become a root canal, which is going to become a bridge, which is going to become dentures. So your spine's like your teeth. So therefore, if you have something, be proactive, get it in an early stage. Maybe you don't even have spinal stenosis, you have like the precursor to it. That if you do nothing, it's going to get worse. Just like you have any problem, if you do nothing, it's going to get worse. It's called the law of entropy, Jerry. Do you ever hear the law of entropy? It's you can't stay the same. So through chiropractic, you get better. By doing nothing, you get worse. Just like if you don't brush your teeth are going to fall out. If you don't adjust your spine, we say your spine's going to fall out.
Now, you know, one of the things that you talked about, and I think a lot of times it's overlooked as well, as nutrition.
Right.
You know, unfortunately, when we go to our, you know, your normal family doctor, nutrition is not a
option.
Something that's, you know, even discussed.
They don't know about it.
Right, right. And that's why, you know, I think it's important for people to understand that, you know, here at Wellness Associates, you take an overall approach to the problem.
Holistic.
Could you tell our viewers a little bit about this overall approach to these problems?
The overall approach that every day your body needs 90 nutrients. Your body needs 77 minerals, 16 vitamins, 3 essential fatty acids. There's a relationship, I'll just tell you off the top of my head, between omega-3 and arthritis. That omega-3 works as an anti-inflammatory, whether it's in your heart, your brain, your joints. All arthritis is just inflammation. In fact, they're saying 90+ diseases are related to inflammation. So if you take in things in your body that are anti-inflammatory, fruits and vegetables. Okay, we have another product here. It's called nanogreens, which is 10 fruits and vegetables, nanosites that goes right into your cell. Fish oil. Okay, fish oil is omega-3. In the Standard American Diet, which stands for SAD, SAD. It's an acronym for SAD. You're eating a hamburger, French fries, pasta. That's omega-6, okay? So here's your omega-6, here's your omega-3. Americans don't hardly eat any fish. So when you take omega-3 fish oil, look what you're doing, Jared. You're balancing out your blood supply. You're balancing out your nutrition. Helps your body heal, okay? Put your body in an alkaline state. Alkaline state helps your body heal. Acid, I don't know if I ever told you this, but acid is what causes inflammation. So when you go to an alkaline diet, fruits and vegetables, nanogreens, then you become alkaline, and that's how your body heals. Acid is inflammation. Alkaline, you heal.
Yeah, I think that's an important concept because, you know, a lot of people don't look at this overall approach, don't understand how their daily decisions are impacting, you know, their whole life. And it's not, most problems aren't a kind of a specific accident. It's more of a accumulation, you know, of these problems, not taking care of yourself, and then all of a sudden, it escalates into a major problem. Where if we can nip it early.
Yeah, see, healing's not an event even, Jerry. So people think of healing as you get a shot of cortisone, that's an event, that's healing. See, healing's not an event. You know what healing is, George? You know what healing is? It's a process.
Right.
Okay? It unfolds over time. It's your diet, it's your lifestyle, it's your nutrition, it's your structure. So we can talk about all four of those. Think of it like 4 cylinders or a car. So if I get my patients on those 4 cylinders, 99 times out of 100, they're going to live a long, healthy, wonderful life without drugs and surgery. How do I know? I know 57-year-old people that feel like they're 25. Why? Because they're doing those 4 things.
Right. Yeah, I think, too many times people just, take some things for granted, take our health for granted. Unfortunately, healthcare today does not stress a lot of preventative medicine.
Right. You're right.
They want to treat it, diseases and with the medications and all that. Where chiropractic truly does get down to the root of the problem, looks at, let's really get down to the root cause of it, not just, treat it with a medicine. Right?
Also preventative. Also,
right.
We do preventative so you don't get to the cause of it, so you don't have a problem. That's, to me, that's being proactive.
Yeah, so, when a person comes in here, say with spinal stenosis or any problem at all, the phases that they're going to go through with you is, and you can explain this a little bit to the viewers, there's that evaluation phase, there's the treatment phase, and there's the maintenance phase.
The evaluation is you come in, we do an intake, history, exam, orthopedic, neurological, chiropractic exam. We determine exactly what the root cause of your problem is and determine what kind of treatment you're going to need, how long it's going to take you, what kind of results you can expect. And the treatment is conservative chiropractic care that you can treat an 89-year-old woman that I treated yesterday, okay, with spinal stenosis. She doesn't need surgery, okay? We're helping her. In fact, I asked her, why did you wait till you're 89 before you got chiropractic? And she said she's finally planning for her future. So what a great attitude. See, her attitude determines her altitude, okay? And then we also do physical therapy, and then we talked about the nutrition. So if you do chiropractic, exercises, physical therapy, nutrition, 9 times out of 10, you don't need surgery. 9 times out of 10, you don't even need drugs, in my opinion.
Right. And from a maintenance standpoint, and one of the, we joke around about the cars and all that kind of stuff, but we almost need an inspection sticker on us, really, where once a year or whatever, you would come in and get that checkup and really avoid a lot of problems.
You check your teeth twice a year. In my opinion, in the future, everybody's going to get their spine checked twice a year because your spine is your brain, and your spinal cord controls every cell and organ and muscle of your body. So therefore, there's a problem there. Find it, correct it. The body heals itself. Did you ever hear that the body heals itself, Jerry?
Yeah. Well, I know that the body is a tremendous, efficient machine if you give it what it needs.
Oh yeah.
It can do a lot of great things. So on all these episodes that we have, we really just want to stress some simple concepts. One, conservative approach is always the best approach. Going some of these radical approaches is not necessary. Exhaust all your options. Make sure you get second opinions on everything. Come down, and we talk about it all the time. Dr. Goldberg is awesome for doing this, but he offers a free new patient evaluation. So if you're dealing with a problem right now and you'd like to come down and meet Dr. Goldberg, get an evaluation, let him explain this concept to you firsthand, face-to-face. No greater way to do it. So we encourage you to pick up the phone, give the girls a call here at the front desk. You're going to love the atmosphere down here. Very friendly atmosphere. Great place to come. High energy. Just to, able to really do a lot of great things with you. So pick up the phone, give them a call, come on down, meet the staff, meet Dr. Goldberg, see if he can't, provide a great approach that can have a major impact on whatever problem you're dealing with. Doesn't have to be what we're talking about on today's show. And also, if you should have a question about a problem you're dealing with, feel free to visit the website at AskDrGoldberg.com. Click on the Ask the Doctor area. You can type in your question. We'd be happy to address it on future videos and just kind of give you some feedback on your specific problem. But most importantly, just come on down, meet everybody, and see if chiropractic care can't make a major impact on your life and the quality of your life as you move forward. So with that, thank you very much for watching our show today. We hope you found it to be educational and enlightening in regards to this problem. And we really look forward to seeing you on some future episodes. Check back frequently. We've got a lot of great topics coming up, and we just look forward to helping educate everybody on the benefits of chiropractic care.